I'm Carol Magruder, and I'm one of the co-chairs of the African American Tobacco Control Leadership Council. And we wanted to bring you this webinar quickly. There's so many exciting, wonderful things happening in the world of tobacco control, and we felt we needed to get in here to give people an update on where we are and where we need to go, because some very important things are happening. So I'm just going to tell you a little bit about us, the African American Tobacco Control Leadership Council, and then I'm going to hand it off to the other co-chair, Dr. Philip Gardner, and he's going to give you a bit of a background on all the things that have happened since 2009, and a lot has happened. So we are the African American Tobacco Control Leadership Council, and we were formed in 2008. At that time, California was having a lot of turmoil in the tobacco control world, and we were the last advocate standing. We're comprised of researchers, advocates, public policy, just about every type of role in tobacco control that you can imagine. And we needed to pull ourselves together to affect the direction of tobacco control policies and practices and priorities as they affect the lives of Black, American, and African immigrant populations. Just coincidentally, the year after we were formed, our President Obama signed the Tobacco Control Act, and that has launched us on a series of events that we could never have imagined when we were conceived. So we're the public face, myself, Dr. Phil Gardner, Dr. Valerie Yerger, we're the public face of AATCLC, but there are many more of us at home in California, and we have pretty much our same original group that we had when we started. We've added a few people, and I just want to give a shout out to all of our AATCLC members who have made this happen for African Americans across this country and everyone else as well. So Dr. Phil, I'm going to pass it off to you now, and then we'll go with Jamie, who will explain what SB 793 is, why we're here, and then I'll chime in, and then we'll have Dr. Valerie Yerger come back in to talk about the targeting. So Phil?
Can I share my screen over your screen, or do you have to get off?
Yes, I think you can, but I will stop sharing just in case.
Good morning, everyone, and I'm glad to see the great attendance. I think it's a great title. I was just talking to Jamie about this. I think it's a great title that we've come up with, Menthol, the Fight Continues. And even though we took a major step last month here in California with the passage of SB 793, we saw what the industry did almost immediately after that. I'd like to frame our discussion this way. That menthol cigarettes and flavored little cigars have been and are the main vectors of death and disease in the Black, brown, and other poor communities of color. The COVID-19 pandemic has just thrown a spotlight on the health disparities and unequal treatment that poor colored communities have faced for hundreds of years in the United States. At this time, nothing could be more helpful in saving Black lives and making Black lives matter than getting menthol cigarettes and flavored little cigars straight out of the Black community. So I think the menthol intersects with the Black Lives Movement, it intersects with the COVID-19, and it should be the driving force in tobacco control work that we're doing. And I'm just gonna this is just gonna be short. This is not about menthol 101 and menthol's bad for you and it makes the poison go down easier, and people, a lot of you have heard all of this. We just want to give a sense of where we are in this fight. I guess what we've come to now know is the original sin, or what we call a deal with the devil. The Family Smoking Prevention Act, proposed in 2008, enacted and signed in 2009. The key players in that were Philip Morris, Southern senators, and unfortunately representatives of the tobacco control movement. That bill eliminated 13 flavors from cigarettes, and the punchline is it excluded menthol. This was the original sin. This was, frankly, the racist act that went down. It essentially threw African Americans, women, youth, Native Hawaiians, Filipinos, folks from the LGBT community, Puerto Ricans, folks with behavioral health issues, homeless, I could go on and on. All marginalized groups were thrown under the bus. The Tobacco Product Scientific Committee was given the order as its first order of business to assess what was happening with menthol as related to poor Black and brown communities. Their conclusion: the removal of menthol products from the marketplace would be beneficial to the public's health. The OMB sat on this report until 2013, and even though it would have been beneficial to the public's health, nothing was done. In 2013/14, the FDA did their own report in the Center of Tobacco Products report, same conclusion as the TPSAC report. Still no action. The tobacco industry sued in 2014, thus effectively blocking even the use of the TPSAC report. That ruling was overturned in 2015. And in 2016, the FDA Center for Tobacco Products came up with their deeming regulations, which we're all still living through right now. Initially called for restrictions on the selling of menthol and all other flavors in e-cigarettes, hookahs, cigars, cigarillos, and the like. This was actually a bold step at the time. However, to add insult to 7 years of inaction and injury, 16 pages of the new deeming regulations were redlined, deleted by the OMB, that pertain to flavors and menthol, thus again exempting menthol. Now it's 2016, we're 7 years into it, and it's still not getting any play. AATCLC took it upon themselves to turn to the local level since it didn't seem to be very fruitful at the national level. And even though there's a number of cities, and I'm only going to mention a few here that around the country have taken it up, we need to give a shout out to Chicago, which in 2013 put out the first buffer zone. This was a 500-foot area surrounding schools and parks that prohibited the sale of menthol cigarettes. Also a shout out to Dr. Valerie Yerger for the 2013 resolution and 2017 resolution that the Deltas passed, condemning the use of menthol cigarettes, or use of menthol. Shout out to Carol Magruder, who was instrumental in getting the 2016 NAACP resolution passed, calling on local chapters to join with tobacco control folks in the fight against menthol. By 2017 and 2018, Minneapolis, St. Paul, Duluth, Oakland, and other cities adopted adult venue exemptions that would allow menthol to be sold some places and not in others. Today, we know there are 207 cities with some flavor restrictions. And then another shout out is to the work done in San Francisco. San Francisco became the first city to pass citywide prohibition of menthol cigarettes. As of August 15, 2020, 65 cities around the country have done this. I'm gonna stop there and come back to the these later developments that have gone on when we end at the end, when I talk more nationally. I think the point is, and what I'm trying to get across to people, we all know that menthol disproportionately impacts African American community and other poor communities of color. There's been a decade of a fight back going on. I want to applaud all the people who worked on SB 793 for all its strengths and weaknesses. Was a major step forward. And of course, the day we took the step forward, signing the bill in August 28th, 2020, by Monday, on August 31st, the tobacco industry had filed for a referendum to remove it from the budget. That's what we're here to talk about today. With that, I'll stop there and send it back to you, Carol.
Hello, can you hear me?
Yes, we can.
All righty. So next up, we have Jamie Long with Public Health Law Center, and he's going to actually explain what Senate Bill 793 is, what it does and doesn't do.
Thank you so much, Carol. So my name is Jamie Long. I'm a staff attorney with the Public Health Law Center. And I'm here today on behalf of the Law and Policy Partnership to End the Commercial Tobacco Epidemic, which is a partnership between the American Lung Association of California and the Public Health Law Center. And we at the Public Health Law Center provide legal research. We do trainings like this one, but we don't do direct representation or lobbying. So Dr. Gardner went through this, and so I won't spend much time on it, but just a reminder of the federal context. We had the Menthol Exemption in 2009 as part of the Family Smoking Prevention and Tobacco Control Act, the original sin. That's the bad news. The good news is that the law has worked, and we know that controlling flavors does work to prevent harm and to decrease smoking use. There was a study just a couple of months ago that found that the federal flavor ban, even with the menthol exemption, led to a 43% decline in smoking among youth ages 12 to 17, and a 27% decline among young adults ages 18 to 25. And the study authors noted that if there were more flavor restrictions, there would be even more reduction in youth usage. We also saw the action by the FDA in January of this year on e-cigarettes, unfortunately exempting menthol flavor again, and also exempting customizable and disposable products. So this leaves a lot of room for states to act, and California has stepped up and done so. So SB 793 is the bill number from the Senate bill. And as Dr. Gardner noted, it was signed into law just a couple of weeks ago on August 28th, 2020. So what the bill does in short is it bans the sale of flavored tobacco products with some exceptions that I'll get into. There has been some attempts to spread misinformation saying that it criminalizes possession, which it does not. It just bans the sale of these products. It covers tobacco retailers. And so unfortunately that likely does not include most online sales, but refers to those that have a physical presence in California. And the good news, thanks in no small part to the fight of AATCLC, is that characterizing flavor in the bill includes mint and menthol flavors explicitly. The bill also sets up a penalty system of $250 per violation for penalties. The exemptions from the bill are three big ones. The first is for hookah and shisha products if they are sold by a store that is licensed to sell tobacco products, where no one under 21 is allowed, and where they comply with the rules for tobacco retailers. The hookah exemption was not in the original bill as it was introduced, but it was added in the Senate before it passed out the first time. The second exemption is for premium cigars, and those are defined as cigars that have a price over $12, that are handmade, that have a tobacco leaf wrapper, that don't have a filter tip or non-tobacco mouthpiece, and that are capped by hand. So a number of restrictions to make clear that we're not talking about little cigars, we're talking about high-end cigars priced over $12. And then there's also a third exemption for pipe tobacco, and that's defined to mean cut or shredded tobacco usually sold in pouches, and it explicitly refers in the bill to not covering tobacco for roll your own cigarettes. So this is intended only to be for pipe tobacco. The cigar and pipe tobacco exemptions were not included in the original bill or in the Senate version, but they were added in the House when it passed out of the Assembly. And then that was the version that became law. So just to put it in a little bit of context, California is the second state to have a broad flavor ban. The other is Massachusetts. And doing just a quick comparison of a couple of points between the two states, if you look at the sales that are covered, that are exempted, in Massachusetts, the exemption requires on-site consumption, whereas California does allow for a direct sale. If you look at the exempted products, Massachusetts exempts the sale of any flavored tobacco product so long as it's consumed on-site, such as in a smoking bar, whereas California has only those specific products. So there are some similarities and some differences to how the two states approach it. Another piece of good news is that there's no preemption. So in California, any locality that wants to go above the state law is welcome to do so. Many already have gone above, and I list a number of cities in California that already have comprehensive flavor bans, including Oakland, Sacramento, San Francisco, and others. These cities won't have any impact to their existing comprehensive flavor ban as a result of the passage of the state law. And any locality that wants to go above the law and fill in some of the gaps that are currently in the state law are welcome to do so. But the not so good news is that immediately following the passage of the law, where Governor Gavin Newsom signed it into law the same day that it was passed by the Senate, just a few days later on August 31st, a referendum was filed. And a referendum, for those who aren't familiar with California law, is essentially an up or down vote on whether or not the voters of California approve of a law. So the referendum process, just to walk through it a little bit. First, the petitioners have to file it with the Attorney General's office. 3 petitioners filed, all of whom had ties with the tobacco industry. And then the Attorney General's office needs to clear it for circulation. They did that last Thursday on September 10th. So that means that the petitions can now be circulated for signature. And they have to gather 623,212 signatures. Because it's a referendum, they also only have 90 days to do it. So that is due on December 10th to the Secretary of State. If the signatures are gathered, then the referendum will qualify. And since this is happening after the 2020 election, it would be going on the 2022 ballot. Unfortunately, that means that the law would be suspended until the voters take action on the referendum. And so for the next 2 years, SB 793 would be suspended if the referendum qualifies. On Friday, the proponents had to file an official top funders sheet, which acknowledges who are the top funders behind the referendum initiative. And no surprise, the 2 that they filed are R.J. Reynolds and Philip Morris. If it does go on the ballot in 2022 and the voters approve it, then the law will be enacted in December 2022. If the voters defeat it, then the law will be overturned. So that's the quick version of the referendum. The petitioners have characterized themselves as the California Coalition for Fairness, but they will have to provide, they will have to disclose their top funders to any signer who is signing the referendum, either on the petition itself or on a separate form. So if they're following the law, then any signer needs to see that R.J. Reynolds and Philip Morris are the 2 top funders for the referendum effort. And just to put in a little bit of context, this has been a common tactic that has been used in California. The plastics industry, for example, was able to delay the single-use plastic ban by 2 years. They filed that petition in 2014, but the voters approved the law, and so it did go into effect by 2016. And the bail bond industry, similarly this year, has taken that approach to a California law to phase out the use of cash bail. And that was filed in September 2018, so similar timing, and that will be on the November 2020 ballot, but the law has been delayed for 2 years in the meantime. So that's the quick version of SB 793 and the referendum, and I will pass it back over to Carol.
Amy, before you go, we have a couple of questions from our attendees.
Great.
Thank you for your presentation. Our first question is from Yaneth Rodriguez. Did Massachusetts law get appealed by the tobacco industry like they did in San Francisco and what they're trying to do in California? what actions did the tobacco industry do in MA, Massachusetts?
It did not, from my understanding, and Philip was shaking his head no, so he may want to jump in here.
No, they did not. They knew what they were doing. They were waiting on California.
Thank you. Our next question is from Carly Moore. Do the signatures need to be original, or will there be allowances for digital signatures due to COVID-19?
So that's a great question. My understanding, and others can jump in, is that I don't know that that's entirely clear yet. I don't know that there's been a determination on that. Generally, the way this works is that signatures are collected in person. They have to be California voters, and they have to be in the county where the voter is registered. So you can't collect them from a separate county. But there very well may be efforts to try to have some accommodations made based on COVID. I haven't seen any official rulings on that yet. Others may want to jump in.
I can add what I've heard, Jamie, from reliable sources, that the accommodations in terms of COVID-19 may actually come in terms of when the validated signatures are due. I noticed that you had a date of December 10th. I actually changed the date on my slide because I thought it was November 26th. So maybe that additional accommodation has come in the last couple of days or so.
December 10th was, I had November 26th in my blog post as well, but the December 10th is what the Secretary of State has put on their website as the official date. So I updated that. That's 90 days after the Attorney General has certified, which is different from 90 days after passage, which is
okay.
Normally what I had assumed.
Amy, we have several questions coming in. Our next one is, do you know of any online resource that tracks the signature count?
So that's a good question. The way that the signature count works is that they are turned in to county election officials by the petitioner. So the campaign run by R.J. Reynolds and Philip Morris will gather these signatures. They will turn them in at the county level. And then the county election administrators will submit the count of those signatures to the state. They have to do that within a certain number of days of receiving the signatures. And then there's a bit of a complicated process in terms of doing a verification of some of those signatures, which I can go into if folks are interested. But I actually don't know if the Secretary of State has kind of a running tally, or if they just put out an announcement when they've done the steps that they're required to do, such as announcing the total number of signatures reported, and then announcing whether or not they have met the verification standards at the local level. I know that they do those two steps, but I'm not aware if they keep a running tally.
It looks like this question of collection of signatures is a hot topic. We have a question regarding what can we do so that they don't collect the needed signatures.
I think we're going to talk about that. That's what Carol's presentation is going to be on in part. Let me encourage us to maybe once Carol does her piece, then let's return to some of these questions, because I think these are the questions. How are they going to be collected? Where are they going to be collected? I don't know if Carol, you can hear me, and thank you, Lon, for hosting. Carol, can you hear us?
She's been texting me, so she's having some technical difficulties. She's asked me to go next to give her a chance to get back on, so I'll go next.
Sounds like a plan, Valerie.
Are we ready? Okay.
We're ready. And we'll return to any questions that we, come up.
Get out of my way.
Big screen, big screen.
I know, I can't move this thing out the way. Okay.
There you go.
Yeah, let me get this out of the way. Hello, everyone. We're really excited to be able to continue having this conversation with you. Phil, Carol, and I are hearing a lot about how happy they are that we've had the passage of SB 793, and we know that that there's some things that we still have to do before we can celebrate the victory. So I like to share this because I want to show just how supportive many African American leaders have been, not only behind SB 793, but in terms of menthol and flavor bans in general. It's important as I start sharing some of the information that we have in terms of how the tobacco industry has been present in the African American community, for members of our community to know that many of us who've been working on this issue for many, many years, if not decades, know that menthol bans are good for our community, and that we know that they are not racist policies. I actually got this flyer or mailer the day that Governor Newsom signed the bill into law. I was actually outside my mailbox. I was cracking up thinking, oh, it's too late, it's too late. So I hope this is the start that the industry will be responding too late, and that we will in fact have our victory long before November 2022. But this individual is a retired police officer from the Los Angeles Police Department. We know that she has ties to the LEAP. I'm sorry, I'm just want to get rid of Phil here, that you guys are seeing my screen. Okay, so we know that she's connected to the Law Enforcement Action Partnership. They've been around for quite a while, causing a lot of disruption and a lot of confusion within our community about these policies that are being implemented across the country. And we've been able to show a direct line between this organization and the tobacco industry. So we've seen this wonderful picture already with Governor Newsom signing SB 793 into law. He actually came into a Zoom room where a number of us were present, and we actually saw him sign. So this was a great day for us. So this is a timeline that I used when I was talking about what was happening in San Francisco and how the tobacco industry pushed back to San Francisco's comprehensive jurisdiction-wide ban. And we see some similarities here. August 28th, we know that the SB 793 became law, and the industry was quick to file its referendum. Starting September 10th, they were eligible to start collecting the signatures. And their deadline, as I mentioned before, December 10th. And we know that if the industry is successful in collecting their validated signatures, that it is going to put the ban, delay the law, at least until November 2022, when the law goes to the voters. But I need folks to understand what this would mean in terms of the numbers of kids who are going to start smoking. I've seen numbers ranging around 40,000 more kids will start smoking if our law is delayed. And also it says nothing about the number of deaths that we're going to continue having as a result. So if California's implementation of this law is delayed, we're looking at the industry generating $1.2 billion in profits. And mostly from the sale of menthol cigarettes. So I want to talk to you briefly about the ongoing industry interference, because this is the threat. This is what we're dealing with. And I think that it's interesting that we didn't see a lot of activity in Massachusetts. And in those jurisdictions here in California, I think we can note a pattern that when the demographics of a certain jurisdiction show a low proportion of African-American residents, we don't see a heck of a lot of industry interference in terms of especially African-American leaders. And I would say that African-American leaders are a big part of the industry's arsenal against our good public health tobacco control policies. Many of you know very well that I'm one of the original tobacco documents researchers and that we have been able to show, my work with Ruth Malone and I documented just why the industry is forming so many relationships with African American leaders. It is because they are very dependent on leaders, not only in terms of keeping a positive image of tobacco within the community, but they rely upon African American leaders to help diffuse opposition that stems from within our communities that are focused on our tobacco control policies. And that it is through their relationships with these front groups, and as Dr. Phil likes to call them, mouthpieces, that the industry can rely on their policy positions being supported at local, state, and federal levels. So some of the arguments we're going to continue hearing, these are arguments that we hear locally from these industry front groups, that African Americans and other communities of color are going to have an increased interaction with the law, primarily because smokers will be penalized for smoking or possessing menthol cigarettes. This is a lie. This is not how the laws are being written. You guys who are on, you understand very well that there is no evidence to support the industry's claim that these policies will increase criminalization. We've heard about menthol bans leading to illicit markets of menthol cigarettes. There's no data to support that. And now the latest that we're hearing is that banning menthol is a racist policy. And we've been hearing this even before SB 793, because there's this argument that menthol cigarettes belong to the Black community. Why are we targeting something that Blacks enjoy doing when we're not in fact going after all the other tobacco products? And with SB 793 exempting shisha and other hookah products, this has really armed the industry front groups with this racist policy argument. So here's our buddy Al Sharpton. I'm going to talk about Al Sharpton because he is present here in California. There is concern that he is increasing his activities, and not only individually, but through other means as well. I want to point out that Al Sharpton's organization is the National Action Network. You see their logo on top of the flyer. We know and have known since at least 2016 that he has had ties with the tobacco industry and supporting their policy positions against our menthol policies. Ben Chavis, I'm pointing him out again, primarily because of his organization, which is the National Newspapers Publishers Association. We know that he has strong ties to the tobacco industry as well. The reason why it is important to know these players is that here we see the mothers of Trayvon Martin and Eric Garner. We know very well what their stories are. We know that they have lost their sons. And here is an example of how they are being, as far as I'm concerned, and I will argue this till the end, is that they are being exploited by NNPA, which is the National Newspapers Publishers Association, which is Ben Chavis's organization, and also NAN, which is Sharpton's organization. And we see them here being supported by these organizations, and they have been utilized in writing letters to argue against public policies related to the ban of menthol cigarettes. Here is something, and I'm going to talk about Reverend Tullis in just a moment here, but here we have the mother of Eric Garner. This was recently posted on Reverend Tullis's Twitter account on August 22nd. I want you to see that he's retweeting Benjamin Chavis and that they openly denounced the proposed menthol ban. They are speaking specifically about California. And this is the other thing I want to point out. Look, there are no comments. Only 2 people retweeted and only 2 people loved. I want us to be sort of clear about what their real impact is and not what their perception of their impact is. Here, I want to show again the relationship between Sharpton and his organizations and interfering with policies that are being considered. This was his interference in New York City's policy. And here is the relationship between Al Sharpton and Reverend Tullis, and you see National Action Network. They do have a connection, and we see how Reverend Tullis has been very active in California. These are pictures that were taken on August 17th down in Southern California, outside of the home of Assembly Speaker Anthony Ridden. They were trying to put pressure on the Assembly member, trying to influence his vote and his influence over SB 793. Here I want to point out, this was on August 20th. And we know that some of these individuals were bussed up to Sacramento. This is outside the state capitol when the state assembly was convening to deal with SB 793. I want to show the connection here. You'll notice their t-shirts. SB 793 is racist. Black Lives Matter. And I want you, and I won't have time to really go over it, but I do want you to note Reverend Tullis's use of Good Trouble 2020. If I could, I would really get into what good trouble really means and how Congressman John Lewis, who we know is good trouble, supported policies to ban these products. So misuse of the term good trouble. Here's what I want to share about what was going on August 20th up in Sacramento. We were having wildfires all up in the area. And I want to point out on this particular day, the quality of air was extremely dangerous. It was hazardous, 345. Under Reverend Tullis's leadership, these poor smokers, many of them were smokers, were outside in this really bad quality air protesting. Where's the love and concern? We do know, and we have heard this, that there were individuals who admitted that they didn't really understand what the issue was, but that they were being paid. So the tobacco industry needs 623,312 validated signatures. I should have changed it to November 10th as we've been corrected. I would say we need to get the word out that individuals should not sign any petition. Tell them to know the truth, help them to see the light, and tell them that they need to be informed. And with that, I want to remind others that we can have a victory. This was from San Francisco. It took us a little longer to get that bill enacted and implemented because of the referendum, but it did go to the voters. We did pass it, and we're here to have another victory. So with that, I'm going to see if Miss Carol is available.
Hey, Dr. Val, before we have Carol come on, do you want to answer a couple of questions?
I sure can, yes.
Sure, okay. So there was a question about what kind of messaging are the referendum supporters using to sell the idea of overturning the law? And you shared that. Are there any ones outside of the ones that you've shared thus far?
So, you know, I think that it's important if you guys are hearing about other ways that the industry is trying to influence, we need to know about it. Right now, we see African-American leaders in the forefront. We've been talking about this issue for years, and it's always, unfortunately, about how African-American leaders are taking money to support industry policies. So this is something that we documented early on in the early 2000s. We're seeing it. It's their typical playbook. So we do know, and it's, you know, and the industry is very good at what? Dividing and conquering and causing confusion. And that's what they're doing. There's just no way to get around good educational and initiatives and engaging with our community directly to get them the information.
Thank you. And then,
Tracy, let me just also add, and I think Val had a nice slide on this. Unfortunately, I think many of the messages that they had out about SB 793 will show up again. Mm-hmm. That there'll be unintended consequences, there'll be police interaction with youth, that it's a racist bill, that it'll lead to a black market. I think we're going to hear that again. I think I go back to the first thing that Valerie said, and I want to encourage people to do. We haven't, they signed it on the 10th, today is the 14th. We are only now going to begin to see and hear these new messages. When you, as you said, Val, I just want to punctuate it. When you hear stuff, let everybody know.
There are two more questions, or three more questions really quickly. They were asking where they can find a copy of the NAN REI Al Sharpton flyer.
I have it.
So
It's been posted all over the place. It was actually one of our mentees sent it to me, emailed it to me the night before he appeared, and that flyer was the attachment. And I know that on the California Tobacco Control Program's website, there's a copy there. So contact AATCLC. We have it. We can get it to you. So Carol, if you don't have it available, I can send it because yeah, we have it.
perfect. And then one question we can answer very quickly is, will people be able to get copies of the slides after the presentation? And the answer is that the presentation will be archived. So you'll be able to see not only the slides, but also the answers and the information gleaned from the panelists. One last question before we have Carol come on is directed towards Jamie. And this is from Twyla Lassiter, one of our community partners at the Soul Project. Her question is it considered lobbying if we put out media messages to discourage voters from signing the petition for the referendum?
That's a good question.
It is a good question. So my understanding is that talking about issues and issue advocacy is something that's within the C3 power to do. You aren't going to be talking to legislators or doing direct lobbying in that regard. So I wouldn't see an issue with it, but I would, think that it would be useful to potentially consult with a nonprofit attorney in California, and we can try to get better information for you on that as well.
There's one more question that's coming up, and I see Carol Magruder, our co-founder, is also on now. And maybe, Carol, you might like to take this question as a segue into your presentation. They asked, can you give an example of John Lewis supporting the bans that you were referring to?
John Lewis was one of the co-sponsors for the Pallone bill, which I'm going to talk about at the end.
Okay, good. Because I had a slide. I just didn't have time to share.
I mean, look at all the slides we could,
Yeah.
So that would be good trouble, is that he was one of the co-sponsors of the Pallone bill, which would eliminate the manufacture and sale of menthol products in the United States, which would be tremendous. But we'll come back to that. Carol? You're on mute, Carol.
Gotta unmute.
Carol, you're on mute.
She says she knows. Trust her.
Yes.
We can't hear you.
I think.
Can you hear me now?
Yeah, we can.
Okay. Now I'm not sure.
No, we can't.
We can't hear you, Carol.
Can you hear me now?
Yes.
Okay. All righty. Fabulous. So I am going to share my screen. Okay. So I could hear, I've been listening, and I think Dr. Val showed this slide. I couldn't actually see it. But just to show, highlight, this was a very exciting day for us, a long, long time coming. And I just want to talk a little bit about the referendum and actually some resources for people as we're going forward.
Carol, we
So
can't
this
see your slides.
Okay. Can you hear me?
Yes.
Okay, so I'm just going to talk. Something I can do. So this, first of all, to our audience, I am literally just being kicked off Zoom. This has never happened before, and we always wonder if it's the mischief of the industry. I don't know how they would do it, but I do believe that's possible. So there are resources for all of us. So we know that that tobacco control, it's a street fight, it's a grassroots fight, and our advice and encouragement to everyone is that we keep fighting. So, this is a slog, and we have to keep going. We cannot think that, take anything for granted. And we know that the tobacco industry is going to fight really hard for California. And we have
Sorry, Carol, you're on mute again. We don't know what happened.
That's what I'm talking about, because I didn't do anything at all. But you can see me now, correct?
Right. So
Okay.
maybe a
Can you
good
see
suggestion-
my slides?
No, if you send your slides to me, I could share them on the screen, Carol.
Okay. I'm just going to keep going because it's getting to be too much for me. So we know that from past behavior that the industry is absolutely going to pull out all of the stops to hold California. And so we talked about the referendum, but we also want to think about that they might also throw other ballot measures on the ballot while they're collecting for the referendum or afterwards. And one of the things that the industry is great at is confusion. So we know that if we confuse voters, people vote no. And so we can anticipate that that's something that's going to be coming. We also
Sorry, Carol, you're muted / frozen once again.
So yes, so we know that the industry, not only do we have to worry about this referendum to annul the law that we just passed in California, but they could also put other measures on the ballot, because California has a system where if you collect enough signatures, you can put absolutely anything you want to on the ballot. So we know from past behavior that the industry could try to preempt cities that haven't already enacted ordinances that prohibit the sale of menthol and flavored tobacco products, as they did with the soda beverage taxes that they ran an end run around us. So it behooves all of us to keep going, to keep fighting, and to know that each city counts, each county counts, each state counts, and that goes for California as the rest of the country. We could also anticipate that in states where it's easier to preempt or easier to meddle, that they will be moving out to block us before we can get started in some of the other states that we're working in. So our voluntaries, like American Cancer Society, American Heart Association, American Lung Association, and the Campaign for Tobacco-Free Kids, they're going to need all of our help, all hands on deck. The wonderful Mr. Mike Bloomberg has sponsored many of our fights that we've had in California, and hopefully he will come back, but we can't necessarily count on that. So our only hope is to really dig in right now and to really educate and inform our community so that when they do hear the tobacco industry rhetoric that Dr. Val already has talked about, people will understand it and they will know that what we are doing is something that needs to happen to protect our communities and to save our children, that our children, Black smokers, are not born with a Newport or Swisher Sweet in their mouth, that they pick that up along the way in adolescence and young adulthood like other folks do, and the tobacco industry is constantly there to make that happen. So we want all of us to know that we will be giving more guidance on the lobbying issue. I think we probably need a separate webinar on that, because we all need to be careful and to, stay within the guidelines of the law as we're moving forward, but to know that this is a hot and heavy fight that is really just beginning right now. So with that, I'm going to pass it back to Phil.
Carol, do you want to take questions now, or do you want us to hold
Sure.
them?
I can take questions now. They're directed towards me.
Sure. I think they were inspired by your presentation. They came in during your time. First question is from Gregory Bolden, who asked, will there be increased smoking cessation programs available for individuals that want to quit as a result of this law?
That is a great question, and it was on my slides. So one of the things that we really are pushing for in all the work that we do now with AATCLC, and we're out all over the country, is that we have to have services for people. And that needs to happen now, not tomorrow. It needs to be happening now. and there needs to be targeted media campaigns, in particular for menthol smokers, and I would say for African-American menthol smokers. So we're gearing up, and as I'm out talking to city council people and elected officials, it's like Katrina, what we're going to do. So at this point, we know that we're taking off one of the most addictive substances on the face of the earth, and people need services. And not only do they need cessation, stop smoking services, they need comprehensive services that address the social determinants of health. I don't think that we spent that much time talking about COVID, but we know that COVID has disproportionately killing African Americans. Our Latinx communities have high rates of getting the disease and having serious illness from it. And that's related to smoking, but it's also related to our systemic racism in our country that COVID has really shined a spotlight on. So those are the things that we need to address. As I tell people, I'm not in the, stop smoking business. I'm in the stop killing my people business. And so we need to have services for people that address stress. And people are under so much more stress than they ever were because of our pandemic that we're suffering through, and all of the political instability that we're having. And so we want those services for cessation to be very robust and to address the underlying issues of stress and racism that affect our community.
Okay, so the next question is, should local cities and counties continue to move forward on the passage of local ordinances? We know local control is best, but we also realize that local legislators may be less open to move forward due to their fear of the industry.
Right. So we need to be encouraging and informing and educating our elected officials that this is the time to be bold and to keep moving forward. What the industry is hoping is that we will have a pause. As Jamie said, when they delay, that's one of their biggest tactics that they use, is just to delay. So in 2 years of delaying, a lot can happen, and a lot of cities and counties can adopt policies that protect their citizens. I read Rahm Emanuel's book about city-states, and so more and more cities are where the rubber meets the road and where our citizens are protected. So we want to encourage local action across the board, and we don't stop until it's done. So we don't take anything for granted. At the end of these 2 years, if we're not successful in beating back the referendum, we will still keep going, and we will have a patchwork of more cities and more counties who have adopted policies to protect African Americans and all of their citizens from the predatory activities of the tobacco industry. And I also want to add in that the leaders that Dr. Val talked about, they should join with us in fighting for the services. I can't imagine that as a leader of my people, which I am, that I'm going to spend my time and energy to bust a bunch of menthol addicted smokers up to demand that they can get their fix, when I need to be demanding that they have services and that Black people too can stop smoking just like other people can. We might need a little more help. And that's what we need our leaders to make sure that our people have the help that they need and deserve.
Mm. And Jamie?
And I'll just chime in on that last point, if you don't mind, that we have seen the tobacco industry lose again and again when they've tried to challenge local ordinances, like just last month in Los Angeles County, when the industry had their lawsuits dismissed against the county, and those are on appeal. But the local governments should know that that there are organizations that have their backs when they're passing these, and that they have the support to do them, and that so far the tobacco industry has not been successful at pushing back on local ordinances tackling flavor restrictions.
Great. 2 more questions. Monty Misex says he believes that they believe that there's a prohibition on the use of Prop 99 funds related to taking a position on a state ballot measure, and suggests that we might double check with CTCP on that. But Jamie has a response to that as well for us.
I think that's good advice.
Thank you. Okay, so Sandy Mandel asks, what can people from out of state do to help?
Everything.
Well, yes, go on, Phil. You want to get that one?
No, I'm just getting ready.
That's part of your talk.
Yeah, I'm going to talk about the national. That's a good trend. Very good, Valerie.
Yeah.
let me share my screen and let's dive into that question some. There's a number of things going on nationally, and I'm just highlighting some of them. Be appraised that there's approximately 24 separate individual local menthol coalitions that have emerged in the last year. Many of them spurred on by our partner, the National African American Tobacco Prevention Network, and funding from Robert Wood Johnson Foundation. And if it's any, not to answer the question too directly, I work with a number of these different local organizations, whether it's in Maryland, Massachusetts, Georgia. So there's things you can do. You can contribute money. You can send examples. For example, we sent folks in Atlanta all of the work that we used, AATCLC and the SB 793 Coalition materials to Atlanta, Georgia, so they could put the Georgia slice on it. So I think there's things that people from out of state can do. And toward the previous question about folks that get Prop 56 or Prop 99 money not being able to lobby, there's a number of us, like many of us in the AATCLC, who can still lobby. So this is something that we have to figure out. I know someone had asked Carol initially, were we going to discuss how you would get a local local ordinance passed. Short story is that you have to do a lot of community work at the same time that you're working with the city officials. They have to go hand in hand. You can't separate them and do that. Having said that, I think to kind of, and I want us to continue to discuss this. Last November, the Pallone bill passed out of the House of Representatives, and frankly, it was the work of the Congressional Black Caucus, or at least the leadership within the Congressional Black Caucus, that made that happen. The Pallone bill, as we mentioned before, would outlaw the manufacture and sale nationwide. The punchline is, and why the fight continues here, there's some of us, there's some people in tobacco control who think that the Senate may actually get flipped, meaning that the Pallone bill would actually have to be taken up in the Senate. Right now, it's just sitting on Mitch McConnell's desk, and if the Senate isn't flipped, it will still sit there. So even though it's a good bill that was passed in the House, and as Val and others have pointed out, this is good trouble that our brother got into. And this is why we titled this webinar, "The Fight Continues." Just getting the bill to the floor of the Senate is a fight. We know that in Massachusetts, the bill went into effect June 1st. We have to applaud that. But as Jamie pointed out, there's a number of exemptions, and what we saw in Oakland, you could have adult-only venues that could sell menthol. We went from 5 adult-only tobacco venues in 2017 to over 55 in 2000. So we should look out in Massachusetts for the emergence of multiple smoking bars around town, where you can smoke inside and therefore still get your menthol cigarettes and little cigars. Of course, I want to highlight the work that AATCLC, the Action on Smoking and Health, and the American Mental Association is suing the FDA. Frankly, if the FDA would have looked at this with a social justice, health equity lens in the first place, we wouldn't even be having the menthol fight for the last decade. We filed suit on June 17th. They're moving to dismiss this. I think sometime on Tuesday. We don't think they'll be successful. And so the fight continues with the FDA and at the federal level and Massachusetts level. And that's what we've been talking about. I mean, this is the level we're up against. We have a major victory on the 28th of August, and a major fight back begins on August 31st. So with that, I just want to say to people that the fight continues. I know we all wanted to take a toast on the 28th, but by Monday we're going to have to put on our boots and fight back. So with that, I want to stop, and I want to take any questions that we have on this. There are numerous things going on around the country, both at the federal, state, and local level, and even around the suing of the Food and Drug Administration.
All right, thank you, Dr. Phil. So a couple more questions that we have. One comes from Raymond Tyler, who is a respiratory therapist and tobacco treatment specialist in Florida. And he says he has a website called rescuemefromtobacco.com and asks, how can he join with the AATCLC?
We should set up a meeting. We should either Val or Carol or myself or some combination of us send an email. We'll set up a meeting. Let's figure out how we can work together.
Wonderful. And this last question comes from Therese Vogue. She says, how can we watchdog the industry as they engaged with local tobacco retailers to gather signatures? These businesses showed their true colors during COVID shelter in place by continuing to sell tobacco. How can we ensure their unscrupulous practices don't continue with signature gathering? And if they do, how can we bring them to light?
Let me say something about the signature gathering, and other folks can comment on this too. The tobacco industry, I did a little homework. You know, the number of gas stations, convenience stores, tobacco outlets that currently exist, numbers somewhere in the neighborhood of 7,000 to 10,000 in California. Just multiply that by 2 or 3 people who work there. They can go to the most conservative parts of California to collect signatures. They don't have to have proportionality in terms of this. There's gonna be a lot of things we're gonna have to fight for as it relates to this. I think how do we expose them? It was interesting, in San Francisco, we got one retailer to come out and said that he would stop selling menthol and flavored tobacco products. Maybe there can be some emphasis on some of that. I don't think that's where we should put our main work.
Yeah.
And I think more broadly, and I'll let you take it, Carol.
Yeah, I agree. I don't think that we should put our energy into trying to fight the signature gathering process because they're going to get those signatures. And we saw San Francisco, which is a very highly educated city, and where their voters voted, you know, resoundingly to support the efforts to get these products off the market, but the industry was still they very easily collected the signatures. I think that we need to dig in, and we need to be informing and educating and engaging our communities right now when, you know, and we're going to probably have for California just a separate webinar on lobbying and just go through all the different scenarios. But as I said, this is the heavy lifting that comes in, where the voluntaries play such a key role in passing laws and supporting us and the foundation. So I mentioned the names of everybody, and all of those folks were on board when we got San Francisco, you know, through all of these efforts. So they're the ones that can do the active lobbying, and they can bring us in under their umbrella as the tobacco control advocate. So we want to fight, you know, roll up our sleeves and fight back hard. But we want to stay within the lines, color within the lines, and there's plenty of things that we can do. And I also want to say that, you know, everything is so racialized in this country, and so our own Black elected officials can block well-meaning legislation because it's perceived as racist. So we are formally inviting non-African Americans to join in this fight with us, and to know that this is about Black folks, but it's about all of us. And that we all live together, our kids are together, and whatever our Black kids are doing, everybody else is going to be doing too. So it's to do all that we can for all of our communities. And so don't shy away from the issue because this is perceived as a Black issue.
Can I chime in? Somebody had asked a question about continuing this fight at the local level. We need to continue doing what we're doing at the local level. When San Francisco passed its law and the voters supported it, it was June 2018. Here we are just 26, 27 months later, and now we have almost 70 jurisdictions, most of them in California, that have a comprehensive ban on menthol cigarettes and other flavored tobacco products. These happened after San Francisco. So we need to keep up the work. And as Jamie said earlier, the SB 793, which isn't in effect yet, but even if it was, it would not preempt the ability of local jurisdictions to go for stronger legislation, which is to go after the hookah, go after the premium cigars, if that's what you want to do, and other things as well. I have been very amazed at how, even though this is a racialized issue, it has been racialized from the beginning. It was a racist behavior to exclude menthol cigarettes from the original Family Smoking Prevention and Tobacco Control Act of 2009. That was racist. But this issue has brought together multiple groups. We have been fighting side by side. We could not have been successful in San Francisco if we kept the focus only on African Americans. There's only 4% of the population in San Francisco that's African American, although we have African American leadership, which was helped to inform that policy going forward. But we had multiple groups side by side. If I hurt, you hurt. We all have to understand that.
There was another question that Jamie was kind enough to answer in the Q&A. And the question was about clarifying if in the referendum, if the referendum makes the ballot, would it be similar to the Measure E in San Francisco, that we want a yes vote to enact it and a no vote to overturn it? And Jamie states that yes, a yes vote approves the law and a no vote would overturn the law. But it's a good question, obviously, because of the deceptive manner in which our ballot measures can be worded. Oh,
That's
sorry.
right, yeah. As a referendum, the best way to think about it is a referendum is a thumbs up or a thumbs down on the law. And so if people like the law as it is, then it's a yes vote.
Thank you. So those are all the questions from the Q&A. Are there any other remarks?
Let me just thank all the people that called in. I know a number of you we've all worked together for years. And I think it's been said by Carol and Valerie pretty clearly, but at bottom, this is a social justice issue or a social injustice issue that disproportionately impacts poor colored communities. It's thoroughly in part of the fight for racial equality in the United States for this to be part of it. Look for partners in the Black Lives Matters movement. It's just as important to get cops to stop shooting Black folks as it is to get Black folks not access to the products that have been killing them the most. Let's not lose sight of what this fight is about. It's about saving Black lives.
And also, if I can add to that, we have to recognize that there are so many other groups that are disproportionately targeted by the industry with menthol cigarettes and other menthol mint flavored products. Thank you, Narendra, for pointing that out. So we need to recognize who our partners are. And I don't know if you guys really picked up on how valuable it is that the NAACP has a national resolution. That resolution encourages their local branches to support local and state efforts. So utilize the resolutions, utilize the AATCLC to help form those relationships that you probably already have and you didn't know that you could add this other valuable tool to your relationship. And also Delta Sigma Theta sorority is nationwide. In fact, we're multiple countries. We have a presence, but here in California, we had a webinar in May we have representation from 28 different chapters in the state of California who attended that. So we are really trying to educate members of these organizations and to use their resolutions to gain access to potential community partnerships. So let the AATCLC help you make those connections, especially if you've got the seeds buried already.
Carol?
Can you all hear me?
Yes, we can.
Okay, great. So yes, I just want to really thank everybody for hanging in there with us with my technical difficulties, and to know that we are so encouraged and that we will be working from California and around the country to keep this train moving. We are going to start hosting a monthly call for African American tobacco control advocates across the country, just to be able to get support. We know that we have a lot of resources in California that other folks don't have, and we want to share at least our brains with you in terms of the work that we're doing in our communities. And that, to support our voluntaries, because they're the ones who will be doing some of the heavy lifting as we move forward. They're working in all cities and states across the United States, and are a resource for all of us.
So with that,
Thank you all.
Are we done?
I think we're done.
Oh, can I end with this? I want to end with this. Please let me end with this. This is my guy. I want to share this. Where? For those of you, if you need to go, you can go. There's too many doggone things here. Here he is. So I want to end with this. All right. Thank you for attending, everyone.
Let's get into good trouble. All right, bye.